Hi, my name is Antti Aristo. I am the Area Export Manager here at Planmeca Helsinki. Today I would like to present you the Planmeca Viso, which you see right behind me. Let's go through its features and let's see what you think about it. All right, so you can clearly see that it's a Planmeca CBCT device. It shares a lot of the same principal concepts that its predecessor, the ProMax 3D unit. You have the open patient positioning, you have the SCARA robotic imaging arm, you have your large user interface, but what's inside the shells has been redesigned. A lot of things has been renewed, rethought of, not only in terms of capability in image quality, but also workflow, patient comfort, patient safety, user comfort, and so on. If we think of the changes that has been made, the visual ones are the new patient positioning tools. You have the new back of the head support. You have a larger sensor, a 25 by 30 centimeter flat panel sensor inside the Viso. You have not only 2 cameras, but actually 4 of them for patient positioning and pro-face 3D face photography options. We have a 120 kV tube head now as a standard to get the most out of even bigger patients, better metal artifacts handling. You have a slightly higher contrast. What it gives you also is the ability to capture larger patients at ease because you're not running out of, well, power. When it comes to larger patients, we also made the tube to sensor distance wider. So now no issues with big patients, with extremely short necks. So all in all, the comfort, the capabilities in terms of what patients can you scan with it has been again revamped, in a way. Okay, so about its capabilities, the Viso is not only a great CBCT device, but you can also take a standard panoramic capture with it. Extraoral bite wings. You can equip the Viso with a cephalometric arm. We have 3D ENT presets, meaning that we have predefined field of view size and anatomical locations preset. You have your vertebra, middle ear, sinus, nose, temporal bone, airways, whatnot. You have your special programs menu, which will then have, for example, here the Pro Face 3D face photograph feature. You can also have the 4D jaw motion, model scans, and whatnot. Okay, so I think we should start from the patient positioning to help me demo it. Nora, please, would you mind joining me on stage? Okay, so we have our patient in. First thing we do is we set the height. Like so. So please, Nora, move forward. Excellent. A little bit higher. There we go. The last thing I need to do is just slide in the back support and we're good to go. So then I press play. You see the SCARA arm doing its work. I can already see Nora's face on the screen. The novelty here with the patient positioning is the live video patient positioning system. So I have 2 cameras facing the patient, one from the front, one from the side. On this patient view, which is the anatomy I'm interested in. So what I can do now here is move this blue box and resize it. The blue box obviously is the representation of the volume size and anatomical target. With the Viso, thanks to the SCARA arm and the large panel, we have the capability to select anything between single tooth 3 by 3 centimeter field of view up until 30 by 30, which is the maximum field of view selection. What I do next is I can select the voxel size, so the resolution. You can go anywhere between 75 microns to 600 microns, depending on the field of view size. Okay, so what I can select next is this small menu here which shows all the artifact removal tools. You have the CALM, which is the correction algorithm for latent movement, meaning that we can actually correct movement artifacts from any patient scan. The patient movement itself is a surprisingly big problem. According to studies, up to 40% of patients move. Sometimes the movement isn't noticeable by eye, but when it's on the micron level, you'll surely see it in terms of CBCT quality drop down. You can also select a different level of metal artifact correction, none, low, medium, high. Usually with patients with dental work done previously, I'd select medium as a default. What you can also do is actually reapply these filters on the Romexis workstation at a later point. An important button to demonstrate is the ULD button, which stands for ultra low dose. This feature will drop the dose drastically without actually compromising image quality. Unlike some of the low dose features out there on the market, you will not see, first of all, drop in frame count. So we still take the same amount of 2D snapshots during the CBCT acquisition. It's not a half rotation scan, it's a full rotation like we do without the ultra low dose. We just use some of our proprietary algorithms to get the most out of the X-ray image quality. Okay, so next I will demonstrate how the Scout works. A Scout is a small 2D snapshot from the front and from the side. Will help us aim our final CBCT field of view location so that we are right where we want it to be. And there we go. You see that you can see the X-ray images right on the graphical user interface. Not only that, what's actually even more important, that you can adjust, again, not only the anatomical target, the location, but you can also resize your previously made field of view selection. So this is very important, not only to minimize the dose of the patient when you can select a big enough but not too small field of view, but also it will avoid the typical retakes that are caused by faulty patient positioning and field of view positioning. When I'm happy with the selection, nothing more to do than, again, to press forward and take the actual X-ray. And when we're done, we release the patient and wish her a nice day. Thank you, Nora. Okay, so next I'd like to present to you a few cases taken with the Viso. First, I'll open up an endo patient. Here you see the 75 micron resolution scan. I absolutely enjoy seeing the level of detail in the scan. I'm browsing the axial view just to give you an idea of the metal artifact reduction. You see that there's no scatter at all from the previous root filament treatment. Not only that, but what I can also see that there is an inflammation that is due to this unwitnessed auxiliary canal. So again, the level of detail is spectacular. What I also would like to show you is this small tiny branch over here that is barely noticeable. When I measure how wide it is, you see that it is 0.34 millimeters. So if you imagine a patient movement of just sub-millimeter level, this is, for example, a detail that would be missed on a typical CBCT device. Okay, next up is a 10 by 12, 150 micron resolution scan. I see that the patient sinus is inflamed. To see the root cause of that, I again browse the axial slice, and there we see what's causing the problem. You have a rather large fracture that is causing the lesion. Nice detail, giving all the information for the clinician as to what to do next. What I can also admire here is the soft tissue definition you see on the Viso. You see the difference between fatty and muscle tissue, usually something you can only see on a medical CT device. Next, I'd like to open a slightly bigger field of view. This is now a 19 centimeter height volume. 19 centimeter is the largest single spin field of view you can capture with the Viso. The largest field of view in general is 30 by 30 with the bigger Viso version. We have two Viso versions. You have the G7 and you have the G5, its little brother. Everything else is exactly the same except for the panel size inside the sensor housing. The Viso G5 will give you a 20 by 17 centimeter maximum volume height. So this is what a single spin 19 centimeter field of view will give you. You have a nice overview of the patient's not only dental but sinus region. You have the back of the crane, you have the airways. This will be extremely useful for your airway studies, sinus studies. Okay, so just to give you an idea what a full skull scan looks like on the Viso, here is one with not only the full skull of the patient, but the neck pretty much as well. You can see that you can count down the cervical spines down to C7. Now let's have a look at the effect that Calm, ARA and Aino algorithms have on image quality. So here is a video of the effect that it does before and after. Here on the left-hand side, you see a non-treated raw CBCT volume with a lot of artifacts. On the right-hand side, you see the corrected one with metal artifact correction, calm, meaning the patient movement correction, and the noise filtration applied. You can see that it makes a big difference in the detail, not only with the metal artifacts, with the patient movement. You can get a much more accurate view of the anatomy without movement, without artifacts, thanks to the Planmeca artifact toolkit. Okay, so that pretty much sums it up. So the next time you're thinking about purchasing a CBCT device, I'd like you to think about the things you've seen today. The Viso incorporates some of the innovations that are only with the Planmeca brand, the Planmeca ecosystem. You have the patient movement correction. You have the SCARA robotic imaging arm, 120 kV tube head as a standard. A lot of innovations within the Romexis software, obviously, that binds everything together, whether it's the CBCT portfolio, CAD/CAM, dental units. It ties everything up as a nice package. One thing the Viso does extremely well, obviously, is large field of view scans. You can take the 19 centimeter height single scan field of view, but it also performs extremely well on smaller field of views. You have the endodontic resolution, which gives you the absolute best detail. You have the ultra low dose function, giving you the perhaps lowest doses in the industry when compared with image quality. A great overall package that will serve you for the next 15-20 years. Okay, I'd like to thank you for your attention. If you'd like to hear some more information about the Planmeca Viso, visit one of our distributors or go to planmeca.com for more information. Thank you and stay safe. I'll see you around.